We live in a fast-paced and hectic world where it's easy to feel overwhelmed, stressed, and out of control. How do you manage all the competing pressures without losing sense of yourself? How do you stay focused enough to not only plot a path, but follow it? Welcome to Recovery Road, a show that offers inspiration, insight, and intelligence, as well as success stories from many walks of life that can show you how you can control your own destiny. Our knowledgeable and entertaining hosts and their guests give practical advice that you can use every day on your road to recovery. Now, here are your hosts, Leaha Mattinson and Greg Bird.
Hi, everyone. Welcome to Master Your Life, the show of insight, intelligence, and inspiration, where I ask you each episode to consider who is it you are right now and what is it you're trying to create in your life. Is your life pretty excellent, or are there things that you would really love to tweak? And that's what we talk about on every episode. It's wonderful this week, once again, on the Divine Wellbeing and Financial Wellness Show to welcome my co-host, Greg Bird. Greg, how are you doing today?
Great. Thank you, Leaha. And oh man, I'm excited again today because I got one of my best friends, Mr. Deepak Sharma of Primus Physiotherapy with us today. This guy, anytime you hear the word pain, he will fix you. I guarantee it. So I'm going to tell a little bit of my testimonial and get right into that. But before we do, we have to do meme of the day before we do a formal introduction here to Deepak. But Deepak, we do want to welcome you. Thank you for joining us.
Pleasure, sir, always. Thank you very much. Yeah.
Excellent. Well, we actually had some really funny things. So I'm watching the hockey game the other night, and remember that one thing I said about the gambling website? It's actually on a commercial now while I'm trying to watch hockey, and that's like enticing me to gamble. So I tell you, that comes up a few times on this garbage on social media, but here's a good one. So this is from my friend Robin White. Meme of the day. Deepak, are you ready for this one? It says,
yes,
March 2021. Pretty much the same as March 2020, but now we have some toilet paper. So
that's funny.
That was a good one. But there's a couple other good inspiring quotes. So this is a quote by Charles Orlando. It says, look in the mirror. You are now looking at the person responsible for your happiness. That's
absolutely perfect.
And this is a good one too. So a little bit of spiritual nature to this one. It says, I threw in the towel. God threw it back and said, wipe your face. You're almost there. There you go.
Some good ones.
Our dear friend Nicole Hornberger out in the world of social media. Thank you, Nicole, for that one. So anyway, so that's our meme of the day, Deepak. I just want to share with the audience here, you and I become really good friends over the 2 years that I've got to know you in our local business networking international chapter, BNI Enterprise. And you've got probably one of the best reputations of members on that chapter. So just a testimonial to you, Deepak. I first got to use your services, your physio, to be one of your consecutive satisfied patients. And I was suffering really, really bad tendonitis in my arm, playing a little bit too much baseball with the little birds in the summer. And then it literally turned to tennis elbow. I'm like, oh my God, I better go see Deepak before it gets any worse. And within one treatment, you literally turned things right around for me. I didn't have to take any painkillers, no medication, heaven forbid ever get any unnecessary surgery. And that's a little bit of your mantra. So Deepak, just to share a little bit about that at your practice.
Sure. Thanks for the awesome introduction, by the way, Greg and Leaha. It's a pleasure to be here with you guys. So we are a purpose-driven company, right? And the reason why we started Primus Physiotherapy was because there is a strong belief that I have that we always wanted to help people in pain get back to normal without using unnecessary injections, medications, or having to go for the surgeries, right? And like the thing is, like, if you are one of those people who need surgery, sure, you need surgeries, right? But all the time we see that in the clinic, that if we see 100 people who have been told that, okay, you need injections or you need to go for the surgeries, by the end of their treatment, we see that only 90% or like almost 10% of those people are the true candidates for the surgery. And almost 90% of those folks, we can help them out without having to go for any of these medications or injections or surgery. So that's our mantra, that's our belief, and that's our purpose of the practice, to help people in pain get back to normal without unnecessary medication, injections, and surgery.
Yeah, it's absolutely startling when you think about that. really, when you think about that percentage, right, of 90% of the people that you're seeing that really don't need a medical intervention. So this is an opportunity for the audience to just do a quick little check-in with yourself and go, all right, so how is my physiology? And, you know, have I been told that I need to have some interventions? And maybe is that true? Because part of the mastering your life is developing an intelligence about your physical, mental, spiritual well-being. And that if you've been told over and over again that the only way to get well is that you need to have medications or stuff that is insidious, that, you know, that's really invasive, that might be what you're convinced that you need to have happen. So I want people to perk up your ears and really tune in to this episode, because you're going to get some alternative treatments, which I'm a huge fan of, because I've been banging on the same drum. So I was delighted to meet you. I was like, oh, somebody who's speaking my language. Yay! So good. So good. So Greg, maybe before we go on, you could give a little bit of Deepak's education and stuff, or share it. Maybe you could share what's your education?
Yes. So I got all my like professional education from India. Actually, I did my bachelor's in physical therapy and then my master's in orthopedic physical therapy, all from India. And when I was in India, I got a chance to work for one of the Asia's biggest private sector hospital. And there was a lot of learning that comes through that. You know, when you're working at such a prestigious institution, you get to learn a lot of things. You get to work with a lot of people who are like pioneer in that industry. People who are really like, they just know their stuff, right? So they are there because of a reason. So yeah, I was lucky enough. I've been practicing for almost 15 years now. Started my first job in 2006 December. So yeah, it's my 15th year running. So I think I've traveled quite a bit, and I like still travel quite a bit to attend different conferences, workshops, anything that helps me educate myself, and anything that helps me become a better professional, or anything that helps me be a better physical therapist. So yes, to achieve that, I've traveled a lot of places. I don't even want to name them, but now in the last few years, I've been traveling quite a bit to states, and that's where my travel is limited to. And I also been, coaching and training other therapists, come from all over the world, and help them be a better physician. And just trying to, because myself, I can only help so many people. But if I have an army of, talented therapists who can replicate the same thing what we do in our practice, we certainly can go and help out many more people.
Yeah, and you were sharing with us, you have 3,000 satisfied patients.
So 3,000, Greg, actually in only in this clinic. So this clinic is not been 3 years old. It's probably, we opened this clinic in July of 2018. So it's a little over like 2.5 years. In just over 2.5 years, we have over 3,000 satisfied clients.
That's awesome.
That's remarkable. That speaks a lot again to your practice, your character, your credibility. Like people, when I talk to the ones that I know that have actually gotten treated by you and any one of the therapists in your clinic, you've changed their life. And I can be one of those testimonials where literally I thought, oh my God, I've really screwed up my arm. And here you just explained it in such layman's terms to me, and then you made me understand the solution, the treatment, and then did the stretches. And man, within a couple of days, I was cured. I can play baseball again without feeling the pain. So there's something about your mantra. You said you don't treat the pain, you treat the source of the pain. Is that correct? Absolutely.
And I think that's where a lot of other professionals, and mainly when it comes to the medicine and the health sciences, I feel like, we don't really do a good justice with our jobs, that because we always try and treat the symptoms of what patient comes to us with. Like a lot of time patient symptom can be like, patient can come and say, hey, I feel pain in my right shoulder, right? And whether it's therapist, physical therapist, chiropractor, even physician, first say, they're like, okay, either go and take this Tylenol because it'll take the edge off your pain, right? You feel better with the pain, but nobody ever bothers to dive into it. Or there's very few clinicians who actually would take out time to dive deep into and see what exactly is causing that pain, because pain is such a subjective finding, and it's just a symptom. So that's one of our mantras, that we would really like to focus on the cause of the problem, not just what's superficially you can see. So if somebody comes with pain, we don't really treat the pain, and we are very upfront about it, and we tell them, hey, don't worry about the pain. I'm not going to treat your pain, but this is what's happening with you, and this is the root cause of the problem. And that's one of the things that we try and explain them, because I also feel like a well-educated patient, they can commit to the treatment in a better way than an uneducated patient, right? So we try and educate them to what's going on with them and why we're doing what we're doing. And then we help them understand, okay, this is the cause of your pain, and I'm going to work on this area. At times it is quite possible when we are doing that you don't see some instant results, but whatever you will gain out of it will be more permanent in nature, instead of just taking a Tylenol or an Advil and get like a temporary pain relief, or just get those TENS machine and IFC machine hooked up where you feel some temporary relief. So.
Yeah, and the temporary relief only can sometimes actually aggravate things, because then you go ahead and do whatever the thing is that you were doing.
100%, right? So because once your pain is masked, whether it's by putting on those taking Tylenol, Advil, or hooking up those TENS and IFC machines, or simply just as rubbing those A535s, they mask your pain for a few hours, so you just feel like a Superman, and you want to do everything and anything, right? and end up hurting yourself more. Yeah.
Alcohol is another one that we see.
Another one, yes.
Another one that we see.
Yeah.
It's not an uncommon way of coping with pain, especially if people have been dealing with long-term complex pain and they've gone to a few treatment practitioners and they haven't had any results. They give up because they just go, I'm standing now in this place of chronic pain and I hurt everywhere and I don't feel in the least bit incentivized to get myself out of that. So the only way I know how to cope is by doing these things that actually cause more harm. And so again, just everyone perk up who's maybe been using that as a way of managing long-term chronic pain. And this might be another way of actually approaching the issue and looking at it from a functional perspective of how do you want to live your day-to-day life, which is what I really appreciated about when we talked, is like, that's how you approach it. So it's not like somebody comes in and goes, oh, it's like I got a sore elbow, but you go, what's it preventing you from doing? And
right. Yeah. So, and again, I think we talked about that too, that, for me, necessarily, like I don't, so for me, over the years, that's one thing I have learned, that pain is not something that affects people as much as their functional limitations. So if somebody who's dealing with, on a scale of 0 to 10, if your shoulder hurts like 2 on a 10, right? But if that 2 on a 10 intensity pain, which is considered a mild intensity pain, is not allowing you to lift your grandkids, like it's not allowing you to even take a gallon of milk out of, of the refrigerator, or it doesn't allow you to put on your jacket, doesn't allow you to, do your hair and stuff like that. So I think that's a bigger problem for you.
That's a huge problem.
Right? So I am a firm believer of that, the pain is not something affect people as much as their functional limitations. And at times it is quite happens that, we treat patients who are, who have some sort of chronic condition that they cannot be completely fixed, but we certainly can treat that condition. And there are two things always, treatment and cure. Not everything is curable, but everything is treatable, right? So we work on that, philosophy, where if we're not able to treat your pain or cure your pain 100%, I'm sure you can live with 2 on 10 intensity pain. But if I'm able to help you, be functionally very active, where you can do your hair, put on the jackets, and do a whole bunch of stuff like that, the life becomes much more enjoyable, right?
So we're gonna have a little fun. Or we're gonna make the audience do some stretches. Deepak, what do you recommend?
Sure, I can show you a little trick of on the posture, and we've kind of talked about that before too. That so let's do a little trick. So all of you who are watching this, just sit straight and tall, and so both arms forward and up, and take your arms as high as you can straight forward up.
Oh, my suit jacket is.
Oh, sure.
I'm gonna rip my back.
And then you bring them down slowly. right? And now I want you to do the same movement in a slouch position
Oh,
and see how far you can go. Not all the way, right?
No.
You're still pretty good, Leah. You're okay.
oh my qigong.
Yeah.
What's
So-
my excuse? I'm not 23 anymore.
Right?
So
So
this
that's
is a
one of the
living
things that. So that's one of the things that shows you, like, how sitting in a bad posture, in a slouch posture, can actually affect your flexibility level, or how does it affect the space between the joints, right? So when you're sitting straight and tall, you have really amazing space between the bones. Your bones are not rubbing against each other. But when you go into that slouch posture, you're actually locking the joint surface and doesn't allow your joints to move to the full limit. Imagining, just imagine doing the same or sitting in this wrong position for months or years together. What it will do to your joints. And, there's a reason, why people, their joint, they start to wear out. And believe me or not, Leah, Greg, I've seen a young girl who was 22 years old with degenerative changes or arthritis changes in her neck.
22.
Just because 22. Right. So it's just because of the constant friction of the bones, and it just gives rise to those degenerative changes and the arthritis changes.
And I think we're
So, yeah.
seeing populations very much younger and younger having these really complex health issues. So chronic pain, all kinds of chronic conditions that are
100%.
almost, undiagnosable in a lot of ways. That sitting in the slouch position also really affects people's breathing. So as we're going
sure.
through this, sitting
Yeah,
and
100%.
sitting inside and going through the COVID stress, people can get more and more, not only complex physical health problems, but also more complex mental health problems just from not breathing properly. So when you think about it, it's as simple as just sitting up and, roll your shoulders back.
Take
and
a deep breath.
Yeah, take a nice deep breath in. There's a lot of
Yeah.
medicine in that, in the chi of the prana, the life force. So that's a fantastic exercise. But again, it speaks to that it's not just the 90-year-olds that are coping with, or the 75-year-olds that are coping with this, sort of complex, debilitating conditions.
Yeah.
Yeah. So that's one. What other things are you seeing in your office pretty regularly? Anything as a result of 2020 in particular, or just?
So definitely, since this COVID started, a lot of people are working from home. The most number of cases we used to see before this COVID started was lower back pain. And again, as per the research, lower back pain is one of the most common condition out there. And then every single person on this planet suffers with lower back pain at least once in their lifetime. It's a given fact in the research. Now, but since this COVID started and everybody's working from home, we actually, so the shoulder and neck problems actually surpassed lower back pain. So now it's so I think 7 out of 10 new patients that we see, they're all neck and shoulder. It's so common nowadays. And it's just the simple reason is because not everybody has well ergonomically designed setup at home. People are sitting on their, dining tables, on coffee tables, or wherever they can find a spot. And my one favorite is, and this is one of my patients, she was a short stretcher girl. She told me, hey, I've tried everything in my house. I've tried sitting on the staircase with a small table, dining table, everywhere. The only place that I've that suits me the most is the toilet seat. And it's funny, right? But yeah, she's like, I just close the seat, I'll just sit there.
That's going to lead to more problems.
I know, right?
Oh my God.
Plumbing problems.
I told her, good thing you don't have to join those meetings on Zoom.
Take the camera off.
Holy moly.
Yeah.
Well, you know what, Deepak? I want to say something just from a financial wellness perspective. Is so many of us have the luxury of having these group plans, and people sift through what's covered, what's not, and physiotherapy is usually one of the main coverages within that. But a lot of people are so reluctant to use it. They'll go just for massage, and they'll forget about all this benefits of if they're in pain. Why not treat the source of the pain, to your point, and go to someone or a practitioner that's going to help? there's a second part to that. Is any business owner, here's a cry out to all of you, that why pay out of your pocket where you've already spent the after-tax dollars on treatment when you can actually open up a health spending account or a PHSP where you can actually then set up this account and have a certain amount where it's so tax effective to use your treatments, Deepak. So any of the business owners out there in Canada that have these types of plans, anyone around the world, there'll be something similar. You just have to work with an advisor to make sure you get that set up properly. But we're doing some of those plans every single day for business owners that, again, are coming to see great physiotherapists like you, Deepak. You may as well get some advantages out of it, right?
Right, sir. Yeah. And just to kind of touch base on the first point that you made about, like, people, they don't use their benefits and all of that. So I discussed with you, right? My mentor, he lives in States, Pennsylvania. So he shared with me this one thing, and that's kind of stuck with me now. And like, every workshop that I do, every webinar that I do now, I always share that. Just tell me, like, what's the one thing, like, if somebody is dealing with their problems, whether it's financial issues, health issues, any kind of issues, if you're dealing in our life, what's the first thing we do about it? We tend to ignore it. Like, our first response is just to ignore it. And unless it becomes like such a big issue, and that's when we, go try and tackle it. But there are really three things anybody can do about any of the problems in life. First, you can keep ignoring it, right? And that's like usually sounds like an excuse where, people, they like to make some excuses that, hey, it's not too bad right now. Okay, I can look at this problem in a few days or a few months or a few years. The second is you can alter it. You can alter it by for when it's health related, you can hey, I can alter my problem by taking some pain pills, by throwing some heat, ice, and this and that. But you're not trying to fix it. You're just altering that problem. My personal favorite is, again, this was shared to me by one of my patients, that, hey, I just don't do what hurts, right? So right? So, so it's basically, you are limiting your life so much that, you've completely changed your lifestyle. So that's two. Ignorance, altering the problem. The third one is handling it. And a lot of times what happens is, by the time we reach to that level of handling a problem, either that problem has become so chronic that you can't expect a complete cure out of that, right? Or you get so fed up that you don't really want to get into that handling phase and just wanted to give up on it, right? That's the reason why, again, it's a little off the topic, but, when you must have seen people, they go and commit suicides and stuff like that.
Yes,
because, right?
That is on the topic.
On the topic. So, and the reason is because when things, they start happening to them, we just tend to put them on the back shelf and don't want to acknowledge them. But, when they creep up a little bit more and they become a bigger issue, we try and mask those problems. But really, when it reaches to a point where the water levels start crossing your nose, that's when you actually try and handle the problem. But I think it's at times it's too late for you to handle that condition.
Yeah. And I can speak to this directly because it's I didn't have any benefits. I could not qualify for any benefits because of this neurological disease that we have in our family. So I've never been able to have benefits. And so right? So anything that I've wanted to pay, it's been paid out of my own pocket, and lots of things have had to be paid out of my own pocket. However, saying that though, you value your health so much because you know the cost of not being well. And so I've got friends who've had tons of benefits and they've used them, and to their detriment, because then they just think, well, I can get one more solution to this thing, and I can, have this medication covered, and I can have this thing covered. But then they don't really, it's like they don't actually really engage full on in health as the perspective, as opposed to going, well, I'm managing illness, and, the whole human right of it's our human right to be well, actually, not our human right to go through life feeling like terrible, or a 7 out of 10 most of the time, and for some people a 2 out of 10. We're supposed to, it's our human right to feel well and to have health. So so whether you've got benefits or you don't have benefits, it's really looking at the quality of life that you want to have, and knowing that, again, to the meme that you shared at the beginning, Greg, right, about you're the one who's got to create that, you're the one who's got to manifest it and to desire it. But then it's the why do people why do people wait, and why do some people take the bull by the horns? Do you have any insight on that, Deepak?
No, it's honestly, it's just, I feel, whatever my professional career have taught me so far, I personally feel it's just the human mentality, I feel. So that's one of the things, we are just, our brain is processed that way. Our brains are trained that way, that our first response to any problem is medication and drugs and pharma stuff. And and again, I don't want to get into the too much detail, but it's just and again, and this is from what I have learned over the years is when we go and buy something, or when we go and purchase something, we don't just would you ever go and buy something, Leah or Greg, that you haven't heard of before? Probably not, right? You always go and buy something that you have heard of, or probably have seen it millions of times, or you have seen it at your friend's place, you have seen it somewhere on TV, social media nowadays, and or some banners and stuff like that. And I personally feel that the pharma industry is so strong, strong that nobody even talks about the conservative care. So for the name of conservative care, what all is available outside is medications, right? And it's just such a big lobby that people, and it's, again, you can't even blame people, because that's what they see all day long. Whoever advertise and go on a TV channel and somewhere to talk about, hey, do you know that if you have any physical pains in your body, there's a 92% chance that a physical therapist can fix them? Nobody talks about those things, right?
Right. Yes. Oh, yeah. Absolutely not.
Absolutely.
They do not. It's very true.
And I'm stating the fact that, if you actually have a physical pain, but anything related to your bones and joints and muscles and ligaments, or any physical aspect of your body, you're dealing with it, whether it's pain or stiffness and any of those things, there's over 92% chance that if you just give a call to your physical therapist office and go there, they would be able to help you better. Instead, if you go to your family doctor, or take some medications first, and then after 6 weeks they refer you for a physio treatment and stuff like that, it just takes longer, first of all. Second of all, the longer you allow the pain to stay in your body, the longer it takes to go away. It's a known fact that a 1 day old problem or 2 days old problem would heal better than a 20-year-old problem. A 20-year-old problem would take longer to go away out of your body, or at times it probably won't go away completely, right? Than an acute condition.
Yeah.
So, yeah.
Now, Lee, you shared an interesting story about Eastern medicine, about the doctors that you paid and then they didn't get cured. You want to share it? I thought that was such a fascinating story.
In China, I don't know if that's still the case, but definitely in the olden days, the Chinese doctors of medicine, the families would pay those doctors the beginning of the year a certain amount, and then they would get the prescriptions for their ailments, or the prescription for the year for each family member, because this would be a doctor that would have known the family through the generations of things. So if a family member became sick, then the doctor actually had to pay them back whatever an amount out of. So it's up to the family so it was like this really great relationship where it was up to the family to follow through on the protocols that the doctor set out. But in Chinese medicine, they actually set out protocols for physical movement practices, but also there's lots of that the cultivating the root chakra through intimate relationships with your partner. And so some of the prescriptions would actually be that the husband go home and make love to the wife, or the wife, let the husband make love, because that was actually the prescription. And so it was like this, interesting, but true. And so now a complete departure from what is going on in our culture now, which is, definitely breaking up, and the value of the family is completely shot.
Definitely. So psychosocial aspect is really like an important aspect of the treatment, right? For any kind of treatment it is. It doesn't have to be like your aches and pains, but any kind of problem that you're dealing with. Like, no, definitely, I'm a firm believer on that. That psychosocial element is definitely important. One thing that I've started teaching to other therapists who have been coaching, and my fellow physical therapists out there. I always tell them, like, the clinic being your technical knowledge or your skills. Like, at least, and again, this is not quoted in any books. This is what I've learned from my experience in the past 15 years, that your clinical skills and your technical aspect of your skills, they only constitute to like 30%. For me, like, they only constitute to like 30 to 40% of your whole treatment, what you do with your patient. The rest, 50 to 60%, it actually the customer service that you actually provide to your client, whether you have good bedside manners or not, and all of those things, and your communication, right? So for me, it's if anybody wants to be a good clinician or health professional, you have to have like a good clinical knowledge. First of all, you have to have good customer service. Like, you should be able to provide that. And the third thing is, you should be good at communicating your stuff to the patient. You can be the best of the therapists, or you can be the best clinician out there. You can be like an Harvard graduate. But if you don't know how to talk to your patient, how to communicate to your patient, for me, you're the worst person out there, right? Yeah.
Take a second to also, you shared a story prior to this recording about follow-up and, following up with clients. And I'll just press on this a little bit. Why it's so important, the follow-up with clients or with clients or patients, is that when you don't do that, patients suffer, and they can suffer for a very long time. And so I was really impressed when you shared this story of somebody who wasn't very happy. We're human beings. Sometimes we're not very happy with the treatment that we get. So can you just share that story, and then how you actually handled somebody who had a complaint? Because I was really
sure. Yeah, awesome. Absolutely. So we had this patient that one of my other therapists treated in our clinic. And so that patient came for the wrist pain, and the therapist treated, did the full examination, assessment, evaluation, and after that she figured out the pain is coming from his neck, because his job is to work on the computers and all of that. I've been doing it for many years, and along with some lower back pain and all. So she ended up treating his neck to fix his wrist pain, because apparently he had a nerve compression in his neck that was causing that pain. So she treated that, and showed him some exercises to go home and do, and she also gave him some exercises for his lower back pain. So the moment patient actually left the clinic, and I'll tell you guys what system we follow afterwards, but after the story. So the patient left the clinic, and within 5 minutes, he gave us a 1-star review on our Google page. And for us, people who know us, if you go on our Google page, that was the second 1-star review. The first 1-star review was somebody just trying to spam us. We never had that patient in our clinic, and I even replied a long post on that hey, I'm sorry, we never found you in the clinic list. This was a genuine concern, and the patient wrote his experience in there. So I went and replied back within 10 minutes, and I asked, and when I came to the clinic, I called him personally. I was like, hey, I'm sorry for your experience. This is not what we want you to experience, but I would really appreciate if you can come in and let me have a look at it, and let's see if we can. I know you paid for your session before, and let's have a look at it and see what we can offer you. So the patient, after came back, and we kind of treated that patient, and that just with one treatment session that he had with me, he felt 70% better. And literally on his way out, he said, "Sir, I feel 70% better now with my wrist pain. And and I'm sorry about that review I wrote. I was just in a weird mindset, and I'll just go today, and I'll go and remove that review, and I'll put a 5-star review on it." And I don't know whether I should have done that or not, but I told him, hey, you're still not 100%. I would like you to wait till you get 100% and then go and write a 5-star review. So. And the only problem where I feel is, and again, I did exactly the same treatment what my therapist did, right? I didn't really do anything different. but I made that patient understand what's happening with him and why, like, we are treating his neck, even though he's having some pain in his wrist joint. So I feel like that education and that, like, and I literally spent like 30 minutes in just explaining the whole context to him, and probably spent like 15 minutes in treatment. That's about it. Right. So and again, later I had a conversation with my therapist that, hey, you didn't do anything wrong, but I think this is one area where we need to improve, that you have to make sure that you help people understand why you're doing and what you're doing with them. So yeah, that's one of the stories, and I'm really happy that kind of turned around, and so we are still so out of 3,000 or so people that we have treated in the last 2.5 years. So literally just one unsatisfied customer so far, and that also is being handled.
I love that on so many levels, Deepak. Took the time to really recover, excuse me, from that instance. But also my last visit to your clinic just last week, and you have all the pictures of the testimonials of you posing with the patients and just the story that they wrote. There's something so remarkable about that. If you want to share a little bit about that.
Yeah, 100%. So we and I'm really particular about like how things should be done. Like, when we open the practice, Greg, I just didn't want to be like any other practice that people go to. Like, we just really wanted to give them an experience, right? And so now, like, and again, I'm telling the truth here that when people come to our practice, when patients come to the clinic, they literally say, hey, we've never experienced this before. And this is like not once, not twice. It's like hundreds and thousands of times it has happened where a patient says that, hey, it's a totally different way of doing the physiotherapy, and I've never received this kind of treatment. So there are a few things that we do. Again, so what you saw on the walls, we have like over, I think, 350 or so patients. So on the last day of when they complete their treatment, we call it a graduation ceremony. So we basically tell them, hey, you are graduating from your plan of care today, because not everybody start the full treatment and complete the full treatment. So because you have completed the full treatment now, you graduated, and so we give them a sheet to write a few words of what they think they have improved on functionally, and we take a picture with them, and then we just hang them all over the place in the clinic. So that's one thing. The second thing is we want all of our therapists to be really accountable of what they're doing, right? Mm-hmm. And oftentimes we hear that patients say, hey, I've been to that clinic, but I've never got better. Or I've also been to that place. I've also been to that place, and this is a very common thing that we hear all day long. So my idea is that when we talk to the therapist, they're like, oh yeah, the patient didn't comply with their exercises, right? So it's literally a blame game that we play with each other. That the therapist would blame patient, and the patient would blame therapist. Hey, the therapist didn't do a good job. And also, like the therapist would blame patient. Hey, the patient didn't do the exercises. That's why, the patient didn't get better. So to kind of counter that whole thing, so we have this something called we write a sheet with the patient. So it's a plan of care kind of a thing. So after the first evaluation and assessment, our therapists will bring out this plan of care that has a few sections in it, and the name and date and the pain and the intensity of the problematic area. But the two most important sections in that is the problem list of the patient, where that talks about their, for example, if somebody's shoulder is hurting, it'll be like pain with limited mobility and stuff like that. And in shoulder, the second line about that is what functionally they're not able to perform. So whether it is difficulty in sleeping, difficulty in putting on jacket, or difficulty in washing hair. So that goes into the second line. The third thing is goals. So the goal section is what your pain is preventing you from doing, and what you're trying to achieve or get out of the physiotherapy, right? Because it doesn't really matter what's in our head. Like, what all matters here is what patient is trying to achieve out of the treatment, right? It is quite possible that the patient goal is not to be completely pain-free, because the patient is living with this pain for many years, and they know that, hey, I don't want to get 100% pain-free. If I get 100% pain-free, that's a bonus for me. But if you can help me walk my dog for 2 hours, that'll be great, So that goes into the goal section. And again, that comes back to the functional aspect of the life. And for me, that's quite important. So we write that. And then at the last three section is the plan of care, what therapist is going to do for the patient, whether it is hands-on and with dry needling and stuff like that. And then at the bottom, we write, okay, how many times the patient need to come and see the therapist? And with a mutual agreement, like, at times the patient is financially not very strong. They say, yeah, I can only come once a week or once in 2 weeks. Sure. So the therapist will accordingly plan the treatment. And at the bottom, they also write how many times the patient needs to do their exercises at home, whether it is 2 times a day for next 3 weeks, once a day for next 3 weeks, whatever it is, it looks like. And then they both sign that form. And we give a copy of that to the patient, and a copy goes into in our record. It doesn't really carry any legal value, but it's a good accountability measure, I feel, because it keeps the patient accountable, because he has signed the document that says, hey, he's going to do the exercises. And it keeps the therapist accountable, because the therapist now has committed to the patient after doing a thorough investigation that, hey, I can make you feel better, or I can help you achieve this goal in next 4 weeks. So now the therapists have to really do anything and everything to achieve that goal. Right. So that's another thing we do in the clinic, because again, there shouldn't be any blame game at all. Like, and again, I can again keep going on and on these things. For me, it's like if you take an analogy of tandem bike. Have you seen those tandem bikes where 2 or 3 people, they ride those bikes together?
Yes.
Just think about a tandem bike where 2 people are sitting on the bike. Then you start paddling. You decide, okay, this is our starting point. This is our our end point. This is where we are going. Then this is from where we are starting. So you start pedaling the bike. What would happen is if only one person is pedaling that bike, and so either that person would get tired and just completely stop doing the stuff, right? Or if only one person is pedaling that bike, may it be the therapist or the patient, it'll take them double or triple the time to reach to their target. Right.
I'm glad you brought up a tandem bike, because truth be known, my first job coming out of university, and while I was going to university, was the big bike for the Heart and Stroke Foundation that has 30 seats on it. So you can imagine 3 seats across and then 10 rows, 30 people. And the going joke in a lot of the different groups that I had come out is everyone would stop pedaling and I'm the only one pedaling. I'm like, oh my God, guys, what's going on here?
So yeah, no, I do remember.
Yep, that hit close to home for me and all the fans we have on the show that know that big bike.
Yeah. No, I remember that we had that conversation, right? I remember you mentioned that was kind of one of your first jobs, right? Correct?
One of them, yep. While I was going through university. Man, that was fun. I got to tour through all the small towns, big towns, all through Alberta. It was great.
It's good times. That's right.
Yeah. So that's a little something that we do in the clinic to keep everybody accountable, right? And I think it's not difficult. And somebody who's who's good at what they do, they're never afraid of these accountability things, right?
Right. Yeah, absolutely. Yeah. I love it. And because then people progress, they can give themselves a pat on the back for actually completing a task when it's done. You can also tweak all the way along too, right? And make revisions.
Right, absolutely. And this is not like a set in stone thing. It's a very flexible plan of care. Some of these folks we treat, if they are so, they really just are on their exercise, they follow the whole plan of care. Instead of 4 weeks, it just takes them 2 weeks to achieve their target, right? And it happens a lot of times.
Can you imagine? I just want everyone to think about that for a second. Yeah. The 90% of people who don't need treatment, who can come in and just follow a little bit of a plan that you might have checked off the list and you could avoid surgery. So for anyone who's actually had any surgery, just remember what that was like whether it's elbow surgery or hip replacement surgery or there's a million things that people go into.
Oh yeah, there's a million things.
The cost of the prepping for surgery, if you've got to have your kids taken care of, or you've got to get transportation there, and then the recovery from all of it, being off of work, just add up that cost.
And there's so much of extra burden, financial burden on the healthcare system. Yeah. Nobody talks about that, but really, if you think about Leah, Greg, about all these what do you call, like the drug stuff and the substance abuse and all of those things, or narcotics abuse, that things are going on, or people who have been prescribed. And I can walk you through this whole circle again. Like, if you think about it, if there is a person who get into, like, for example, a work-related injury, right? That person goes again to the doctors, and again, like, based on what they find out and in his body, they may just start him with some mild painkillers. It can be simple as Tylenol and Advils. And what if the patient doesn't get better with Tylenol and Advils? Okay, you make another two-week visit, then you are on naproxen or you're on tramadol and stuff like that.
Right.
Things don't get better, right? And then you are on Tylenol 3s. Things that don't get better, then you're on Tylenol 4, then like codeine, and it's just a vicious circle that you keep getting trapped on, right? But once the person is on Tylenol 4s and, like, all these morphines and codeines, it's a totally different world altogether. Like, now the person is basically just started affecting their psychology and all of that stuff. They just don't either, because they're so used to those medications, they don't want to be off those medications because there's nothing else to manage their pain. So now, because now cognitively they're not healthy, physically they're not healthy, what's going to happen next? Like, they'll drop off out of the workforce, right? Who bears the burden of that? Every single person who's paying for your taxes, right? In Alberta, every single person, because because they go on the social security stuff and they get the funding from the government. What happens next? They go on AISH and stuff like that, and they get the social benefits and all of that. So now it's just a vicious circle, right? And my point is that all these things is very easily preventable, right? It doesn't really cost, like, how much money does it cost to get a surgery done, or to even get a cortisone injection done, right? Whereas if you compare that with, like, a regular physiotherapy treatment session, how much would it cost? Like, there's so much of difference, right? And you can it costs you $80, $100. That's about it to get a session. And where the probability of you getting better is way higher than just taking the medication on the long-term basis, because that's just masking your pain. And this is kind of helping you fix that. Again, I'm not against these things, but the problem is, if you are the right candidate for them, for sure, take them. Like, if you need surgery, great. If you are the right candidate. But the problem is that a lot of patients that we treat, I personally feel that they're not the true candidate for them. And they're just being, the drugs are being pumped in their bodies.
Good point. Now, you brought up a whole other thing that I think we should speak on. You talked about mental health, but you also talked about mentorship. And you have a great mentor in Pennsylvania, I believe you said.
That's right, sir.
Did you want to give him a little shout out and how important?
Oh, 100%. Since I met him, so his name is Chad Madden. And I met him in 2017. And since then, like, the way I look at my professional life, it's totally different. Like, I definitely owe him a lot when it comes to my profession and who I am as a clinician, and who I am actually as a business owner. For sure. And there are some people that they actually think at a different level, and if you hang out with them, like, they elevate you to their level. So that's what I feel, that I'm really lucky to have a mentor like that. And and he's an amazing person, great guy. I think is one of the 40 most influential people in the healthcare industry all over the world. So I can't. It's always like, I'm always short of words when I'm talking about him, but he's amazing.
Yeah,
I'm lucky to have him. Yeah.
And it sounds like you've been mentoring some people that are working for you also as, students and clinicians. So you're passing down some of that knowledge that you picked up for your mentors. We talk about mentorship on the show very frequently because it is those 5 people that you hang around the most are the people who you show up in the world acting like. Or the 5 things that you ingest the most is the things that you hang out, that you're putting out in the world. So if you're watching 18 hours of Netflix and it's all about zombie apocalypse and
Sons of Anarchy
and whatever, just that's what you go, why is my life so chaotic? I don't understand. It's probably because it's like your neurological wiring. We're sensitive beings to this. stuff. So, and also, I think people, when they become cloistered or closed up to mentorship, because when you get sick, all of a sudden you don't want to take advice from anybody. Right. You're kind of in this, I don't want any advice. I'm like in my little cocoon of aching and paining all over the place. And so it is this breaking out of your own, story and being able to go, how could I get out of this fiction that I've created for myself of a really unhealthy, unhappy life, and instead point my ship towards, happiness, health, and wealth. And that you weren't doing that all the time. It's like you found this fellow along the way, just like I think most of us, have had a little bit of shipwrecks here and there, and you go, and then you pick yourself up and go, okay, well, how am I going to get across the Rubicon of this next thing?
Right.
But finding who are credible, huge.
Yeah. And I think oftentimes what happens is like, like what you want to do in your life, like, what your mission is, like, what you're trying to achieve out there, but you just don't have, it's important to have the right people on your side, right? And at times you just don't have right people with you, like who can mentor you, coach you, who can guide you, because like, that, hey, I have to take that route, I have to take that path. But whether like, and if I take that path to achieve my target, to achieve my goal, or to reach to that my final destination, what's the best sources I can utilize, right? You like, as a person who has never been onto that path, I don't know anything about it, right? If there is somebody who has been on that path, he can guide you that, hey, if you use bicycle, you're probably going to take 5 hours to reach there. But if you use, a car, you probably would reach there in like 10 minutes or something like that. So I think it's really important for us to have somebody who can guide you and provide you the source and provide you the information and the knowledge and all the tools that you need to achieve your goals, right? Because they don't write the goals for you. They don't give you goals. They basically polish you as a person and help you achieve what you have in mind. So yeah, but it's definitely 100% important to have a mentor.
And it's so important to actually pick people who actually have achieved the result that you're trying to achieve. I say this in business coaching all the time. If you are trying to build a 7-figure business, don't hire somebody who's only had a 5-figure business, right? But people do it all the time. It's like, oh, I'm going to ask my Aunt Martha how she, how to lose 100 pounds when Aunt Martha's never lost 5 pounds in her life. You just go, this is why we're still stuck into this, the illness thing.
For the record, I don't have an Aunt Martha.
Neither do I. Neither do I. But the financial wellness stuff, when you're building a business, having good business people that can coach you in a lot of different areas when it comes to, retirement planning or estate planning or insurances or life, just insight about things, then hiring somebody who's credible and, got good credentials or good experience or the combination of things.
Right.
It's a huge advantage. Yes.
Yeah. I think again, like our brain is programmed in a way, like, again, I'm talking like the human brain is programmed in a way that we always go after the credentials, like, how many degrees person has and from where they have the degrees. That's what matters to us the most. We don't really look at the bigger picture, like what they have achieved, in their life. And again, like I've seen lots of people out there who be like, hey, they would, or even like in our industry, how that works is that, if somebody needs to get, like, for example, again, like they need to visit a good orthopedic surgeon or a good doctor. They're like, and if you're in States, okay, I'm only going to go to a Harvard educated doctor. I'm only want to go to somebody who has graduated from Yale or Stanford. That's about it. I don't want to see any other person. But you just don't know that, a Harvard educator or a Yale educator or a Stanford educated, definitely they have like amazing skill set that they have learned, but they probably haven't practiced in an area where they haven't even seen the condition what you have got or the problem that you are dealing with, right? Whereas if you go, get a treatment for somebody like, in India or China, an orthopedic doctor who have seen in the last like 5 years of their practice, they have seen like millions of people with the same condition, but unfortunately they don't have the degree from Harvard. So, where are you best served? You're definitely best served with somebody who has treated the same kind of patients 1,000 times versus somebody who got good credentials, but have only treated one person of the same problem.
Right. And agreed. So thank you for clarifying that, because definitely, it's not the credentials, it's the wisdom and the experience.
Yes, absolutely. It's the wisdom, and because there's no match to the experience, 100%.
Yeah.
One last thing you did just on the mentorship, and we're coming up on the hour, and we'll do our song of the day, which is actually a really neat tie to our conversation. But you did something really neat for your staff. Is speaking of mentorship, you invited me out, and I got to bring one of my mentees, Leaha, along to talk to your staff. So you just want to share a little bit about that, how you invited me out?
Yeah, for sure. So there is something that we do, and again, it's very unusual. Like I haven't seen any other clinics for the last 15 years I've worked with. But again, when we started this practice, is one thing I always wanted to do in our clinic was implement everything and anything that I hated, or that was not available to me at any other place. Right. So, for example, this was one of those things. We call them mentorship sessions. So every Wednesday, so we close the clinic, we shut the clinic main door from 12 o'clock till 1:30. The 12 to 12:30 is our weekly meeting. And all the staff members attend them. And from 12:30 to 1:30, we mentor. We kind of designed a schedule on it. For example, today we'll all study about neck pain or just neck condition. Then we go over there are 4 weeks in a month. So first week we'll talk about the basic anatomy, the key points to look at, and like that. So we have designed the whole system. But I've also now, we talk to the staff, what I want is once a month, I want to invite somebody, because nobody taught us, we only know the health side. Nobody taught us how to be, how to better utilize our finances, how to better manage our finances, or it can be any, how to have a good accountant, those kind of things. So I thought, okay, that's a really neat idea. Okay, let's do this. And so from now on, I'm going to invite once a month somebody if I know somebody in my circle, I will invite them. But if you guys want somebody specific to come and talk here for the next 1 hour every Wednesday or once a month, let me know what kind of professional you guys want. And I'll make sure I'll reach out to them and I'll invite them here and provide us with some wisdom, whether it's a field of law or legal aspects or financial aspects, accounting, whatever. Somebody needs to buy buy the house. I'll get a good realtor in and have them explain you what things to look for, what not to look for, so you don't end up burning your money out. Right. So that's the idea that I had, and I think when Greg, you came in, you were the first guest actually for one of those mentorship sessions, and it was very well perceived by the staff. And I know you had to encounter some harsh questions there, but again, because awesome. Right. So, but again, the thing is that anybody who's really highly educated, they are always critical of things, right? And being critical doesn't necessarily mean anything bad. They just want to make sure that whatever they are getting into, it's all good stuff. So, but right after you left and we had a little meeting afterwards, my staff came to me and was like, hey, that was really great. I really appreciate you bringing Greg in, and and thanks for letting him share his information and all of that.
That was awesome. And what? I always say that never ceases to amaze me, where in 18 years in my practice, I think I've heard it all. And then someone out of the blue will ask me a question I've never heard before. And boom, you had two of them in your room in less than an hour, ask me questions that I've never heard before. And there's never a silly question. So any of you listening today or watching us today, if you have any questions as it relates to physiotherapy, everything we talked about today, financial wellness and planning, please reach out to us. Deepak, what's the best way to get a hold of you?
We are situated in Edmonton, so you can give us a call. The number is pretty straightforward: 780-540-1234.
Yeah.
Yeah. So,
are you open for doing any business coaching? I wonder if you would actually have some people reaching out to you, possibly.
Maybe.
I would be happy to. I would be happy to. Whatever knowledge I've gained from my mentors, I'll be happy to pass it on for sure.
Wonderful, wonderful. And Greg, you're going to take out the show with, of course, the song of the day.
So I thought this was a good one. So Leah and I, we always ask, what's a good song that kind of fits? And we were talking a lot about pain today. So Deepak, we always talk about pain. So this one's by REM. Everyone's has heard this tune. It's called Everybody Hurts. But actually ties to more of the emotional pain. So I thought this was so fitting for you, Deepak. So here you go. Everybody Hurts by REM. When your day is long and the night is yours alone, when you're sure you've had enough of this life, well, hang on. Don't let yourself go, because everybody cries, everybody hurts sometimes. Sometimes everything is wrong. Now it's time to sing along. When your day is night alone, hold on, hold on. If you feel like letting go, hold on. If you think you've had too much of this life, well, hang on, because everybody hurts. Take comfort in your friends. Everybody hurts. Don't throw your hand. Oh no, don't throw your hand. If you feel like you're alone, no, you're not alone. If you're on your own in this life, the days and nights are long. When you think you've had too much of this life to hang on, well, everybody hurts sometimes. So hold on, hold on, hold on. Everybody hurts by REM. There you go.
So true, sir, right? Yeah.
Well done. But you don't have to hurt anymore, because you can follow up with Deepak Sharma and Greg Bird. They'll be happy to help you out of your physical and financial pain. Thanks again, Deepak, for joining us.
No, it's my pleasure to be with you guys. Thank you very much. Thank you.
I'll take out the show to say, everybody, love yourselves, love each other, mind your mind. That's all for us. Bye for now.
Thank you for being a part of our program today. Master Your Life is a presentation of Leaha Mattinson Enterprises, Inc. Join us next time on Master Your Life, helping you to discover the very best of you.